our presentation today. We are excited to have with us when she gets out of her car and into her office, somebody from Misty from Allegheny Family Network in Pittsburgh, Pennsylvania. And she has done a lot of really great work around building and maintaining partnerships and how important it is for our work with families and for our work with policymakers to build and maintain those partnerships. And she's going to talk about that. So while we're waiting, I'm wondering if you wouldn't mind putting in the chat, or you're welcome to unmute and just shout out something. What would be, I'm trying to think of a good icebreaker that we can work with here. Bridget, if you have one, I'm open. So,
hi everybody. My go-to icebreaker, which always gives me ideas of what to get from Home Goods, is great. What would be your perfect fall day?
Oh, what would be your perfect fall day? Thank you, Bridget.
So
go ahead, Jeanette, go ahead. Yeah.
For me personally, my husband and I have a castle project, and our favorite thing to do is to see what castles we can find in the area to go and explore that are abandoned. So fall is perfect for that. We pack cider and we just go.
Great. Where are you from, Jeanette, that you find castles?
Greenville, Ohio.
Oh.
We do Ohio, Pennsylvania, Kentucky, Tennessee, Virginia, anywhere we can find them.
Cool, that's great. I see from Tamika, sitting on the beach, drinking coffee, listening to the waves. That sounds very relaxing. Very relaxing. I love to tinker in my flowers. And I love to just be outside and water flowers and prune them. And I'm from Utah, Salt Lake City, Utah, and we're having perfect fall weather right now, which is about 75 degrees and sunny, and it's just lovely. Cool and sunny outside. I missed it, it went away. Oh, sorry. Fire pits and s'mores, I like that. So Linda, I'm so glad you're safe from the weather, so glad. Apple Hill, Western, what's SD, South Dakota? Perfect fall day today. I love those days. Watching the colors of the trees from the backyard when I wake up in the mornings, awesome. And we do want to wish our fellow workers and colleagues from Florida to be safe. I hope that that's an awful storm that they're dealing with. Another fun thing that we do in the fall, we used to do, my mother loved to go see fall colors, and we would take her for a ride up into the canyons and see the fall flowers or the fall colors, and go over the hill into Bear Lake Valley where they grow raspberries, and they're famous for their raspberry shakes. So raspberry shakes and fall colors are really, really a good fall day. Anybody else? Thank you for sharing those things. So today our presentation is building and maintaining partnerships. I have not heard from Misty yet, but we're going to go ahead and get started on some of these things. So this is the disclaimer from NTAC to know that this information was prepared under a direct funding from NTAC and the Substance Abuse and Mental Health Association. Substance Abuse and Mental Health. Okay, she said she's not getting in, Bridget. Is there something I can do to help her?
I will reach out to her. You go ahead.
Okay, do you want me to put, oh, okay. So this event is supported by SAMHSA and the Department of Human Services. And so anything that is presented here today you're welcome to use unless we specifically say that it can't be reproduced. But please make sure that you're giving Misty credit for the work that she has put in putting this presentation together. Let's see. So just in case there are any security issues, if there's something that happens, NTAC, who is supporting this today, will cut or shut this down immediately, and we will send you an email with further instructions. So a little bit about NTAC, and NTAC is the National Training and Technical Assistance Center. These are the partners that are included with NTAC. You can see all of the great organizations that have come together to form this, this group. And it includes FREDLA, which is who I represent, and Youth Move National. And it's important that we keep in mind the system of care values and principles that always include family and youth. So we're happy that they have done that. Okay, and the goal of NTAC is that all children, youth, and young adults and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. You know that there are formal system of care out there that are funded by SAMHSA, but there are some informal systems of care as well. And we hope that they are also joining us and understanding and following the values and principles of system of care. So this list is a list of the audiences that NTAC will present to or cover or talk to or train or give technical assistance to. If you are or know of people in any of these audiences, this cross sector of audiences, and they need some technical assistance, we're more than happy to, NTAC is more than happy to take a referral and help them in any way possible. So these are some of the things that NTAC does. Oops, went too far. You know, they provide, yay, Misty's here. They provide individual consultation, peer learning exchanges, custom coachings and training academies, communities of practice, 5 Things Digest, podcasts, practical tools, and more. And NTAC is starting with their year 3 plan, and it includes more things than what you see here. So please stay in touch with NTAC and know where their website is and get on their mailing list so that you have access to all of this as well. Misty, are you with us?
Hi, I'm here.
Oh, I'm so happy. You're probably frazzled. I'm so sorry.
No, it's completely okay. I apologize for the delay in me getting on. I thank you for your patience. And this is very exclusive group to get on to, so I'm very excited to be here.
Well, we're glad that you're here. Misty Woody is the Chief Development Officer at the Allegheny Family Network. Here's her contact information. And just so you all know, you will be getting a copy of these slides. So you'll have this information. If after the presentation is over, you have more questions, you're welcome to call her or myself, and we'll try and help you out in any way we can. So Misty, you were right on time because here is your slides.
Oh, perfect. Thank you. And I did have to come in through a different link. So if it's okay that I just let you know when the next slide, if that works.
Yeah, no, just tell me and I'll move them. Yes.
Okay. Well, welcome everybody. Thank you so much for joining us and for allowing me to share a little bit of some of the experience that I have with building and maintaining relationships as far as a family support agency and also a player in the mental health and behavioral health kind of arenas that our families and youth are actively engaged in daily. So a little bit about me. My name is Misty Woody. I am the Chief Development Officer for Allegheny Family Network. And I have just recently acquired this position. Before I was the community development supervisor for the agency. And I have kind of worked my way to that role, building relationships and maintaining them and really rallying a community around our family and youth. So we are a family-run organization in Pennsylvania. We are located in the Pittsburgh area and Allegheny County, if you're familiar with that. We do also have the statewide agency, which is the PA Parent and Families Alliance, and that covers all of the counties in our state. I do have a unique perspective for some of the systems I'm going to touch on today because I also was a former school board director for our local school district in Pennsylvania. I did also work as the community relations manager for the school district, and I got a lot of insight into what families need and how we operate as a school from that experience. And most of all, I'm a parent. So I believe that's my greatest experience and also what value I can bring to different tables that I sit at. I am the parent of 3 children. My oldest is my identified child, which makes me qualified to work in family support because she does have some mental health challenges and some behavioral health challenges as far as a diagnosis of PTSD. She has extreme social anxiety. And then also she has battled with depression, eating disorders, and self-harming. So we are in a good place right now, but through our journeys, we have kind of navigated through many different systems, as I'm sure some of us online today have. Some of the systems that we've navigated through to get her to where she is today include special education, behavioral health treatment services, mental health treatment services, some children, youth, and families involvement there. We've also had to navigate the medical system for her. She is a teen mother. I'm a grandma just recently within this year, which I am very, very excited about that because the babies, who doesn't love babies? We've also gone through family court and we've had some juvenile justice as well. So one of the things that I kind of wanted to talk to you and encourage you today about is, as a parent, really using that unique perspective and insight to support your, I guess, outreach, your attempts to build relationships, and really your understanding of the systems from the other side of the table. And using that to help build and maintain relationships with your agency and organization. And we can go to the next slide. That's okay. So very quickly, I kind of just outlined a little bit of what I want to touch on today. Another thing that I would like to mention in the welcome and introductions is that I think that we all may get Zoom fatigued, and I'm not really entirely a fan of sit and get. So if you have any questions or comments that you would like to add, you can use the chat function and someone will be monitoring that and can kind of put us on pause to be able to address your questions or concerns. I love interaction. So please also, I believe there's a raised hand function that you can use and we can have a conversation instead of just to sit and get, because we've had that for about 2 years now. And I think some of us might be over that. I also want to talk about why we need to value partnerships. And kind of the pursuit of partnerships. And I wanted to touch on a little bit about my strategies for building partnerships. I'm sure some of you are using the same strategies, and I hope if you're not, maybe it's something that you can pick up and utilize as well. And I just wanted to talk a little bit about how partnerships benefit parents and families and outcomes, and how you can apply your principles and values to maintain those partnerships. And then at the end, we'll be able to go into breakout groups and I can get some great ideas from you guys. And we'll debrief and they'll give you information about the next meeting. Next slide. So this is a little bit of fun, just to kind of get your ideas. I know that we have a lot of different people online today, and I was just wondering if we could share a little bit about who you partner with in your role. And the Menti link is in the chat, so you can click on that, and I believe a code will pop up. And then we'll be able to kind of see some of your current partnerships and some of the roles that you guys play, if you want to play along. You could just type it in there and give a couple different answers. I think some of the common ones probably will come up. Some of the places we partner with include obviously like the school districts. And does anyone else have any interesting ones? I know someone has one. I would try to play with the Menti, but I'm afraid I'll get kicked out of the meeting because I have difficulties getting in. Okay. All right. Well, we can go ahead and maybe we can come back to that and ask, maybe we break out into that a little bit too.
So I tried to go there and it sent me away. Bridget, is there a reason? Did it do that for other people as well?
One moment, please.
Okay, I see Terry put in the chat, she partners with families. And CPS, I'm guessing that's Child Protective Services. We call it CYF here.
Let's try that link.
Okay, we have another link.
Apologies, folks.
And we've got some lived experience in there. That's great. I'm not seeing the shared screen if you're trying to share it. There we go. Yay. Okay, perfect. Policy boards, that's always a good one. Local orgs, schools, I knew that was going to pop up there. The pregnancy center, that's a good one too. And thank you for that work because, as I said, I just went through that. And P2P USA. And then we did have some Child Protective Services in the chat and the Family Resource Centers. I love those. Those are great. Okay. Caregivers. Just looking around.
I am lost.
Juvenile probation officers, yes. I bet those are fun partnerships too. And family coordinators, okay, that's awesome. Child serving agencies, public health, mental health programs.
What is CYS-JPO?
I'm thinking that's children, youth, and services, and maybe we could put what is JPO in the chat, because juvenile probation officer.
Oh, of course.
Mm-hmm. All right. Okay, great. Thank you guys for sharing. We could go to the next slide if we're going to get back to that.
So I am trying to share. Lost. Okay, share.
All right.
All right.
There we are. Yay. Okay. All right. So
now I have to find us again. Hold on just one second.
Mm-hmm.
Okay. Now I'm ready. All right.
Let me go to the next one. So obviously those are a great variety of different ways to partner with people and who we partner with. And I think that really touches back on, I saw that someone had shared in the chat a little bit about their lived experience. And I think that may be why, you know, they're working with the partners that they do. And that's the whole point. We have to be able to take our experiences and what we learned from them and build those partnerships, even with systems that maybe we didn't have the greatest experience with, because it will ultimately benefit all of our families that we serve, by providing that system and those people, especially like those policy boards with our lived experience. One of the things at AFN that I love about our agency is we have a parent advisory board. I think the reason why I like that so much is because even as family members have this lived experience, once we begin, you know, our training and really understanding the different systems and the responsibilities and the laws, and even just going to work every day, kind of in that middle space, we can get a little bit separated from our original experience and thoughts, and kind of like our passion to change. So whenever we have any new ideas, even just brochures or verbiage or anything, we always run it by our parent advisory board so that we can make sure that we're really staying in tune to our parent voice and that we are still speaking to families. So that's kind of just a side note as far as building partnerships and maintaining them, because we have to remember like where we came from and who we are. And I will touch on some of this, but sometimes that can be difficult when we start really getting into collaboration with other systems and providers. We can kind of get into that gray area where are we still maintaining our desire and our passion to represent that family voice and keeping true to that while also trying to build and maintain a relationship. Like I said, sometimes with systems that weren't always a great experience with us. And one of the ways that I try to do that is by applying my principles and values to my efforts. It helps me remember who I am and what my goal is when I'm trying to navigate through what can sometimes be a little tricky to building partnerships and maintaining them. Some of our values and principles are family voice. Obviously, number one, we really believe that families can advocate for themselves. We do that through empowerment and education, and helping them understand, you know, different systems and then choices, and kind of guiding and supporting them through making decisions about that. We also believe about natural supports. Our systems can sometimes have natural supports in there for families, and maybe our systems or our organizations or our partners need to remember that and recognize that. It helps make them feel important, and also it helps with the outcomes as well with families. And then obviously our strengths-based approach, we believe that all families have strengths and assets to be acknowledged and built upon. And again, no matter what my experience with different systems and organizations, I try to believe in that with them as well. So I really try to draw out like what their strengths are and how they're helping our families. And give them insight and maybe a little bit of my experience to help improve those strengths and make it a stronger organization, process, partner for our families. And collaboration, like, that's one of our principles. We have to build and maintain relationships because it's one of our principles is to be collaborative. Also persistence, and I will kind of touch on some of this in the coming slides about how I had to be a little bit persistent in some of the pursuit of partnerships. And then also individualized attention, really just letting, whenever I'm building the partnerships and trying to maintain those, I try to remind them that even no matter what organization or system or group it is, that our families are still individuals and very unique. And while they may have a process or a system that will serves to serve everybody or a large group, that we still have to really make sure that we're individualizing families for outcomes. You could go to the next slide. And I'm sure you all have some, principles and values that you can maybe tie to as well. But I mean, really sticking to those is one of the things that I really try to do because it is who we are and we have to maintain that identity. So I was going to talk a little bit about partnering with schools. I'm sure depending on what state you're in or even county or even district, it can be easier or maybe more difficult to create solid partnerships with schools. And I wanted to say that, in kind of each section here, I'm going to touch a little bit about why we need to value partnerships. And one of the reasons why I wanted to start with schools is because they are one of the entities that all of us have to be involved in at some point. It's kind of a center to our communities and to our families. And it really is designed to guide and support our family growth and our youth growth. But the problem with that, it can be that they're struggling as well. Schools really were short-staffed when it came to supporting our students that fall under IDEA. And then also, especially our BIPOC students. And this was like nationwide. You can see with the statistics there that, there was a lack of service. And was that because of a lack of understanding or a lack of support or a lack of staff or a lack of funding or all of the above? But also our low-income students, which are low-income and BIPOC students, statistically, are more at risk of many things, including mental health and behavioral health. So this is very concerning that the schools are kind of trying to do this on their own. And you can go to the next slide. Even schools that have, some kind of mental health support systems and staffing, and especially like just adhering to laws, don't have enough. So it's really, they're short-staffed with the supports that really do address our children's mental health. And that's just with the children in the building. That's not including the different outreach and supports that the families need outside of the building and beyond just this, what attention the student gets in the school. So you can go to the next slide, please. Schools definitely have a lot of responsibility. They have been kind of pigeonholed as the go-to place for mental health, for food, for education, for a lot of different things. And it makes sense because they are, funded in different ways. And then also they're in our communities and all of our families and children should be touching on them. However, again, they have been short-staffed or in some areas have traditionally just not been very attentive or fair or equitable to different populations, especially with families with mental health and behavioral health. The way that they provided instruction and mental health and things like social support, such as food, was interrupted greatly by COVID. And I don't think that we've been able to bounce back on a lot of that. we've seen a lot of students and families that have had a lot of truancy involvement, especially during COVID when a lot of the schools shut down or went online. We saw that families were getting wellness checks and they were not logging in, whether it was technology or whatnot. But there was a huge gap in just the instructional delivery alone, much less the time that school staff had to check in and kind of be that connection to families and welfare, like just even understanding that they're okay and helping them with what they need. We saw a lot of increase in IPV and child abuse during the COVID shutdown, and the social supports and methods of operations just were not going to, they took a long time to even just get back on track as far as like educating the students. So students became lost. There's a huge population of kids that went to cyber school and didn't return back into the building. Those kids are not necessarily connected to a school system if they did not return. A lot of the online schools are operating differently and under different rules in different jurisdictions in different states. So there's not really always a requirement to, as far as the attendance and other ways of checking in with the families. There's a lot of dropouts. There was a lot of absenteeism, and really that hasn't improved, and it will take probably, I would say, at least this school year and some of next just to get kids back in the buildings at the rates that they were. And that kind of provides an opportunity for us as family support providers and direct support to be able to find those gaps and help engage families and students back into the school. One of the reasons why it's really important, I believe, to start really looking at how we're partnering with schools as support systems is because the government and different stakeholders and funders have found that the schools and community organizations and groups that have direct contact with families really are the ones that need to be trusted and empowered to be able to bring supports to families. And because the schools are the center of where every family should be attending, they have been getting a lot of the funding as far as mental health and behavioral health support funding and security funding. That the government's noticed we needed to be able to increase and be able to address what was going on during COVID and after. And so the schools are getting a lot of that funding that we can help them use. Recently, there was a huge funding effort brought out to Pennsylvania schools. And, we reached out to each school and said, hey, you've got this funding. Let us be a partner with you. We can come to your building once a week, meet with families, provide family supports, and really help engage and re-engage parents who also are struggling with getting their kids back into the swing of school and the programs. We identified the need, and we were able to present and offer them an opportunity that probably was actually significantly less than some of the other ideas that they may have had as well. Some of the things that we do to partner with schools is offer them free trainings for parents. So if they have their PTO or PTA groups, we can push in a free training about mental health or behavioral health, or even just parenting classes. We provide the childcare, the food, and if families need help with getting transportation, we'll support ways for them to get to the meetings as well. That helps the schools increase engagement in what they want to discuss at their meetings or what they need from parents, which often can relate to academics as well, and helps the schools also connect with the parents about their attendance. And we did that, and we're able to now help with truancy efforts as far as student attendance improvement plans. We're going to be piloting that into school districts where we'll be able to be invited when the parent is facing truancy. And it's helping create a bridge between the school system and the families that has been separated completely by the pandemic, but also was maybe just a little bit broken before that. There's, whenever you're in the school system and your kid has behavioral health or mental health like mine, you can face things like, I don't know, the magistrate and getting fines for truancy. We've also gone through some expulsions in my house. We've gone through, daily messages from teachers, and it can become overwhelming for parents, and they can just kind of put a blockade up and not want to deal with that system. With us providing that partnership, we can really sit down with them and say, hey, this is what's going on. This is your right. This is your responsibility. Let's communicate it well to the schools and create those opportunities for better outcomes in the end. And we also, like I said, can provide them suggestions for funding use. And once we've connected with the schools connected to a lot of different agencies and organizations too. So automatically we form new partnerships just from that partnership with the school as well. You can go to the next slide. Okay, so creating connections between families and schools also. We've been able to do, again, parent trainings. We are partnering with them at events. We will help host the events. We can also just attend the events. We've helped host things like early childhood sign-up nights. So, we have a little mini fair where we have all of like the daycares, the darts, Head Starts, the Early Childhood Center for Pre-K and K, and we're able to connect all of those and then provide our own information and resources to parents who may just now be starting to see those challenges, because we know that if we can connect them to good, valuable information without having them feel judged, then the child can get connected sooner and outcomes improve dramatically. And again, truancy support and then emergency needs. So there are some limitations to what school staff and school administration and school policy can offer and do. We as family peer support providers are able to go beyond that and be able to help the parents offline, out of school day time. We're able to do home visits. And right now, some of the schools are really bringing in some great programming with like community school-based behavioral health, or even just improving their student assistance teams. And by us partnering with them, we're able to share out with the parents and the families, yes, you may have had this experience before, but this school now has these different funding avenues and these different programs that they're starting. And let me tell you a little bit about it, because we think it will be able to help your child and maybe help reconnect the family to the schools so that the child can actually benefit from those supports. And also, most importantly, really, once you can kind of create that partnership, the school system will be more open to what you have to provide as far as parent voice. And, we've gotten a lot of feedback on just the school administration or teachers contacting us and saying, hey, I'm having a really hard time engaging with this parent. Can you give me some ideas? We've actually started provider consultation line so that they can call and get some kind of feedback and information from one of our supervisors who's able to give ideas and resources to other providers to be able to improve parent engagement. And some principals and students administrators are participating in that provider consultation line, and it's working out really well. And we can go to the next slide. We also were able to support families through the pandemic, which schools could not do because they completely shut down. A lot of the schools were kind of thrown off by just closing down. They never had to do that before. And they really didn't know exactly what some of the families actually needed in their communities or how to provide supports for that and direct connections to that. Part of it was because their staff and their employees are typically required to work only during the workday when they're operating or a set calendar. We were able to go beyond that and partner with the schools to help distribute food, get students to laptops and electronics. provide parent support with children community learning hubs. So we were able to use our community networking to open 3 remote learning locations and be able to provide like a safe space for children to get online and learn and parents to be able to go back to work. And then we also were able to educate parents and professionals on truancy and helping them make those well visits instead of having to revert directly to police or CYF. And that actually, I hope that never happens again because the pandemic was terrible, but it was a good example of, you know, a community need, and we were able to identify that and really think creatively and connect with the school and use their resources like the food, the electronics, and even just connecting to the kids' academics when we're supporting them remotely with learning. And that created a really, really strong partnership in schools that typically, or previously, I'm sorry, really were kind of closed doored and wanted to do their own thing. So if you do have an unfortunate community urgency or need, and you're able to kind of reach into different programs or schools and say, hey, this is what we can do, let's partner together and we can help more families or help them more immediately, then I would advise you to take advantage of that. And we can go to the next step, or next screen, I'm sorry. So again, collaborative partnerships in the community. Some of you had put some of your partners in Menti, and it looked like you guys are doing great things with that, such as the family resource centers, even looking at, I'm sorry, I can't remember exactly what some of them were, but I know some of them included DNA groups and some of the rehab facilities. Those are awesome ways to create partnerships in the community. There's a lot of different people that are engaging already with families, and they are doing really, really great work. One of the things that we did at Allegheny Family Network was we were able to identify a few of those different organizations, including our friends at the Allegheny County Department of Human Services. And we saw that there were pockets of communities that had kind of like needs that were bigger than us individually. So we took the opportunity to identify those needs and invite a bunch of different faith-based organizations, residents, like concerned citizens, churches, school people. We were able to bring in the hospital, a CDC, Allegheny County DHS again, was one of our major partners in that. And then also the health department. We have about 30 to 35 groups and organizations that get together once a month and really just identify some needs specific to the communities and that we are meeting in, because now we do about 3 different communities, and just combine our resources and our relationships and our our unique partnerships to address those specific needs. We also are able to use those partnerships and that time to train each other in different things, like the Women's Center and Shelter comes in and gives us information about IPV. And during COVID, that was helpful because it was a major thing that was going on that we needed to know. How can we walk around this problem and help people directly while being informed, because you need to know a lot about that. We're able to bring in the hospital, and they talk to us about different in the health department about different trends in health in the communities, obviously beyond COVID, because we were all able to rally around that one. And then also we were able to look at how there's different funding opportunities and collaborate to be able to offer a different piece to each project that we propose. And we are able to secure funding that way because there's strength in our partnerships, and funders see that and they value that. We're also, boots on the ground in the community. So if something comes up that we need to address, or that there's a major issue, we just kind of put out a bat signal, and everyone that can contribute in their unique way does so. And we really are able to canvas more, reach more families, and also provide more supports to individuals from that collaborative and community network kind of kind of mission operated outreach. And also, don't forget your elected officials. They want to participate. They have connections to funding and financing, and they also obviously know like a lot of different players in different arenas. And they're allowed to join these community groups and have partnerships with you. And also, they can be really helpful whenever you're trying to address something quickly. And we can go to the next slide. Another thing about those collaborative partnerships in the community is it really does help kind of pinpoint where there are needs at and where there's gaps at and draw attention to that. And we've been able to actually open community-based offices as well, where we can do kind of like triage supports and also connect walk-ins or even people that call directly to resources in their community, especially in areas that can be lacking public transportation or maybe, maybe be a little more rural. And I cannot say that word properly, so you can go to the next slide. And this is kind of, the photo actually is one of the projects that we did through one of our community networks called the Highlands Partnership Network. And we were able to identify the areas of the community that were, had like food deserts, where there weren't any grocery stores. And also maybe there was, from the health department, we found out there was high levels of obesity or diabetes or something that diet could affect. And we were able to secure a grant for $50,000 to do a community garden network. And what we did was just kind of go to our partners and say, do you have space? Do you have grass that we could plant some seeds? And we were able to create 3 community gardens and also provide the supports and information and volunteers to residents to help them understand how to build that up. And also we created a bike share to be able to connect. People could borrow bikes to get from garden to garden. And, you know, collaborative meetings help us identify those concerns, who can contribute what, increase labor efforts, and accomplish our goals. And then once we do that, we identify another need and we start all over. And we could go to the next slide. Some other beneficial partnerships that we've seen really go beyond kind of person to person and more like institution to institution. One of the ways that we love to contribute as a partner is as a panel guest or a parent representative. We also love to partner through becoming really informed on what's available as far as resources, how people qualify for that, and connecting our parents and families directly to those resources. It helps them accomplish their goals and it helps us help our families. Another thing that we're really excited to be a partner in is the Parent and Caregiver Support Research Study. And that is actually a FREDLA is a partner in that, as well as the University of Colorado, the Oregon State Family Network, and also Allegheny Family Network and the University of Pittsburgh on this side of the coast. And I believe the University of Wyoming is in that too. And we are actually enrolling families into family peer support services or resources. And they answer surveys about quality indicators and give us information that will help us collaboratively and through our partnership of doing the research study, provide data for other agencies and organizations to, encourage continued support financially and just as far as becoming a part of the systems of care for family support agencies. And it's very exciting. I'm kind of a data nerd, but it's very exciting to me because it hasn't been done before. There's not really a lot of solid research-based information as far as parent and caregiver supports. And so we're really excited to be able to participate in that and then hopefully provide that out for everybody to use. 988 came around. We were able to use our partnerships to get surveys directly to families and directly to individuals and organizations, so that the people that were creating the 988 systems nationally could have good information about like what people needed, how often they had to use emergency services, what they would like in a 988, and they're going to use that surveys from our many partners who were able to distribute that information and help form 988. And also get the word out about it, because it's going to be a valuable resource and more people need to know about it. And then also just becoming information outlets through direct support providers. Partners love to work with us because once we know their information, we definitely share it out and connect families directly. And if that's showing that resource is effective or that partner is really doing good work, it will help them with sustainability as well. We can go to the next slide. Okay, so I'm sorry that I kind of spoke very, very fast. I hope everybody got a little bit of some information or ideas for that. And I believe we are going to be going into working groups now to discuss these questions. Lori, did you want to touch base on this?
Yeah, hold on.
Okay, take your time.
I'm not at my desk and I had to get a piece of paper.
That's totally.
So I thought you had some really great ideas there. I love the community health gardens. That was an awesome piece. So we're going to now break into some groups, 2 groups, and to just talk about what are some barriers and challenges that you've encountered when you're trying to build and maintain your partnerships. And then second, based on that information, based on those barriers and challenges, what are some of the strategies you have used to address those challenges? So I'm going to ask Bridget to break us into Okay. Okay, good. Everybody's here. Everybody's back. So I wanted to just take a couple of minutes to just debrief a little bit about what we've talked about in our separate breakout rooms. And Misty, if you wouldn't mind going first, I'll go second.
Yeah, we had a great conversation. Some of our challenges that we had were kind of being new in positions and in partnerships. How do we prepare for those kind of meetings where we're expected to have contribute? And we were able to come up with ideas and strategies for that, such as like Google alerts for trending issues that maybe you should be aware of before you go into those rooms or into those discussions, especially if you're new. Understanding like who the partner is and really kind of being educated on what they do and how you can kind of provide services in the gaps, and always being like really confident in what you have to offer. I know sometimes we can seem like we're at tables where maybe we're not exactly like the smartest person or the most adept person at the topic or even the training or whatever, but we do have, again, a valuable insight, and we are kind of charged with representing Family Voice. So just shake it off and be confident and be sure that you can contribute that whenever you're invited to that. And we also had some ideas and suggestions for some kind of sensitive informational sessions, like addressing runaways. And we talked a little bit about how we can partner with families to offer kind of individual, but also group sessions with parents and group sessions with kids, talk about the same topic, and then kind of share the information out so that families can actually have kind of a core conversation about that. What did you guys talk about?
So that's very interesting. Thank you. So we had some of our challenges were moving from one position to another and understanding what your role is in the new position. Sometimes that's hard, understanding that role. Getting buy-in from professionals sometimes is hard, can be a challenge, and finding equity and respect at the table. When you're the lone family member, or maybe one of two or three, finding equity and respect there is hard. A couple of things that we talked about that would be helpful is just getting creative on how to make yourself known there at that table, and to work with parents and children in a different way that the professionals have not seen before. Making sure that they understand that we're there to build bridges. We're not there to take anybody's job away. We're there to build bridges, and we all need to work together and be creative in those groups. One person talked about how it was important in her state that her organization has a really good reputation. So building reputations is really important, because when you're at the table and you're representing your family organization, then everybody knows what to expect from that person and is glad that they are there. We talked a little bit about the training and how it's different, and credentialing for different, working with adults or working with families or working with children. It can be all different, but somebody suggested running a pilot project, and all peers come together and are trained in core areas, and then they branch out into what their expertise or what their lived experience is. And I thought that was a really great idea as well.
I love that idea, and I'm going to do it. Yeah.
Spokane County and 25 of our organizations in behavioral health have put funding into that pilot program here in Spokane County.
Wow.
It is so amazing. The first time we ever met was at the public library, because there's no fee there. And we did a training, an equity training, just to kind of get everybody some snacks and get together.
Sure.
There were 70 people that showed up the very first event, and now we've got 160 something on there, and I know there's more of us out there. So we're just digging. And so let's say this place has funding for housing or something, we can daily talk to each other. Or, gosh, I've got a client looking for these needs, and we could just really bring that in. And then I don't work with people I'm an SUD peer as well. So bringing that to the table, I have no experience in opioids. So I always ask the expert, I've got a lot of peer friends that I get with.
Yeah.
And say, I don't know. Can you educate me,
Sure.
And they'll sit down. It's amazing. It's a lot of fun too.
Yeah. Very good. Thanks. I have about 4 minutes, because they have a hard cutoff here right at the bottom of the hour here. So I want to get through our last bit of slides, but I wanted to leave this for Misty, because this is the essence of what our training is today.
Absolutely. So this is something I really thoroughly believe. Families cannot do it alone. As again, a family member and as a parent, and I had all the boxes checked. And when I went through the hardest times with my teenage daughter, those boxes did not matter, because nobody else had the box of parent that I did. And so I really understood how I had to really connect to my resources and just find ways to help support and find treatment and services that could help my daughter and ultimately help my family. And I know that families need us to work together so that we can show them and kind of make that an easier process than it was for me or you or what some of them are going through now. And I believe that we can do that through partnerships. And I really do encourage you guys to go out and chase those partnerships and build them up.
And thank you so much, Misty, for your time and your efforts today and teaching us more about building partnerships. I really appreciate it. Next month, our meeting will be on October 26th. It's tracking outcomes. We did a training a while back on evaluation, and this is a little bit different. This is actually tracking the outcomes and what tools are used. And it is from the Wisconsin Family Ties. She's the head researcher for Wisconsin Family Ties, Robin. She was with us a few months ago. And so you'll get the slides. This is the registration. If you haven't registered for the whole series for the next month's, please do. And so next month, that's what we're doing. We will send you a little survey. It's very important to us so that we know how we're doing and if there are things that we can do better. Would you please take a minute to fill that survey and let us know what you think. And here is the contact information for NTAC. And if you need technical assistance, that request TA line is really important, because if you need something that would be helpful, more training, more individual training, please go there and you can receive this technical assistance for free from the National Technical Assistance Training Center. So let's see. SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. So that they are the ultimate funders here, and that's who we are getting paid by to do this. And if there's anything that we can do for you, please take a few minutes. And thank you so much, Bridget Okawi and Joanne, all of a sudden Bloom. And thank you so much for being our technical assistants today and helping us learn more, be available on this Zoom call to help us, everything be available to us. And again, thank you, Misty, for all your work, and we'll see you all next month.
Thank you. Thank you so much.
Happy Halloween.